have, I guess, two questions I'd like to ask you. I guess 2 comments and then 2 questions. The first comment is that regarding the health care law as it stands now, we've been told that we'll be able to keep the health care that we have. My husband is self-employed, so we buy our own health insurance, and we have one of those policies with a huge family deductible, like $7,500 in a deductible, and we self-pay, and we pay for, thank you. Yeah, watch the glasses.
I'd hold him. I'd hold him if you want.
He might spit up on you. But anyway, we self-pay, and we have to pay for all our own visits until we get to $7,500, and then it's basically one of those catastrophic policies. My concern is that under the current health care law, we will be told that our health care isn't, my husband's already looked at it, and according to whatever is defined as sufficient health care coverage, our health care, which we actually like now, is insufficient according to the government, whatever. And so my husband has told me that what would happen is we're going to be fined some huge number of thousands of dollars per year.
Unless you buy the mandated plan.
Buy the government plan. I don't.
No, that is true. That is true.
My mother and father taught me better manners than that. I think you guys can understand it. So what happens to those of us who want to keep the health care that we have? Are we going to be forced to buy this other health insurance that's going to probably provide lower coverage at a higher cost? That's number one.
The answer is yes.
Okay. Number 2, I have read that the health care bill, which is supposed to be about health care, is going to fund 15,000 additional IRS agents, which is an average of 300.
16,500.
Okay, sorry, I got the number too low. And that the IRS is going to be the enforcement mechanism for this. Since when does health care have to do about the government thugs coming in telling me that I have to do X or it's going to come out of my taxes? That's all I want to know.
Or college loan program in a health care bill. My twin brother is not insurable at any cost he can afford because of a pre-existing cancer issue. He has found through a cooperative, not the cooperative that was talked about in the health care bill, but a national cooperative, that he can find coverage that pays for surgeries or treatments he has, and has worked very, very well. Under this bill, that cooperative would not be allowed, because it does not have the mandates in it, it does not have the requirements in it, it does not have the coverages in it, because it is not an insurance plan. So, personal for me. Yes, sir.